My students and listeners at home, you are welcome to St. John's Online Teaching. With you now is Mrs. Ezeokobe for the Department of Social Studies. Our topic is HIV/AIDS. Our specific objective: by the end of the lesson, the students should be able A. to explain the full meaning of HIV/AIDS. B. State how HIV/AIDS is contracted. C. List signs and symbols of HIV. D. Identify its dangers and solutions. Now we are going to look at the meaning of HIV/AIDS. HIV is an abbreviation. It has two meanings. HIV 1 is human immuno-deficiency virus. The number 2, human immune deficiency virus. If you are asked as a test to write the full meaning of HIV, you can write any of them. Don't mind the immuno or immune. The two of them are correct. HIV is a disease that destroys human immune system of the body and makes it unable to combat diseases. S is a deadly disease caused by a germ called immuno-Deficiency virus. The disease destroys the body's ability to fight infection because it breaks down the body's immune system. Otherwise, disease that destroys human immune system of the body and makes it unable to combat diseases. The terminal stage of HIV infection is called Acquired Immune Deficiency Syndrome. That is the S, known as soldiers of the body, and leaves the affected person exposed to various disabling and life-threatening illnesses. S is a social problem since it affects the quality of life of man in the society. How HIV is contracted or transmitted. HIV is transmitted or contracted through 1. Sexual intercourse. 2. Contact with HIV-infected blood and blood products. 3. From an infected mother to her child, unborn child, before, during, or after birth or delivery. The number 4. Sharing of skin-piercing instruments or objects like razor, needles, syringe. Now we are going to look at it one by one. Number 1, sexual intercourse. The major way through which HIV is contracted is through sexual intercourse. HIV is transmitted through semen, vaginal fluid, blood, and anal mucus. Number 2, contact with HIV-infected blood and blood products. For example, 2 persons using one toothbrush or by blood transfusion. When a person who is not having this HIV has a contact with somebody with this HIV through the blood or through blood products, maybe by using toothbrush, the person can automatically get infected. Number 3, also from an infected mother to her unborn child, during or after birth or delivery. When a mother wants to deliver a child and he delivers it through normal delivery, the baby will contact HIV. But when it is done through cesarean operation, the baby cannot contact it. It is likely that a mother that has HIV will transmit the virus when she delivers through normal birth canal. But when she delivers through cesarean operation, the child will not contact it. Number 4, sharing of skin-piercing instruments or objects like razor, needles, or syringes. When an infected person with HIV uses skin-piercing instruments and another person without HIV uses contact, we contact the virus. For instance, now you want to go and cut your hair in the barbing salon. You don't have your own machine. Now, when the barber uses his own instrument to cut your hair, maybe she has cut somebody that has that HIV. If he uses it for you, you can also do what? Contact it. That is why you go and buy your own, for your own only. One cannot know a person that is infected with HIV by merely looking at him or her. You know the shape for face. You can't notice it by merely looking at him. The only way to find out is through blood test, unless the condition of the infected person has degenerated to S. That is when you can guess that the person is suffering from this sickness. Symptoms of HIV. 1. Constant fever for upwards of 1 month. 2. Chronic diarrhea that may last for more than 1 month. C. Loss of weight without any explained cause. D. Persistent or long-standing cough. E. Recurrent skin infection. And F. Enlarged love gland. Now let us look at the dangers of HIV. Untimely death. 2. Stigmatization. 3. Strain on the family members. Financial burden. Orphans. And the last one is loss of what? Employees. One of the dangers of HIV is death. HIV leads to death as it has no known cure. 2. Stigmatization. The victim of HIV/AIDS suffers great emotional trouble because people try to avoid them like a plague, as if they are carrying shit in their body. It's because of the sickness. Number 3, strain on family members. Family members living with AIDS victims sometimes have to leave their work to look after them when they become sick. It is not easy for them. They must do because he or she is their blood. Number 4, financial burden. Family members of AIDS patients spend a lot of money on medical care and proper nutrition for them. Also, some families have lost their chief income earners to the diseases. All these factors have forced them into poverty. Number 5, orphans. AIDS victims die leaving behind orphans. These children may have their potential unrealized if they have no reliable or rich person to take care of them. Number 6, loss of employees. Organizations are deprived of workers if their workers die early as victims of AIDS. The loss of workers in their young age clearly slows down the development of the economy. Now let us look at the solution. Can there be any solution? Yes. Number 1, education. 2, responsible sexual life. 3, sharp objects. 4, blood fluid. 5, pregnant women. 6, screening. Now we want to look at the solutions of HIV. 1 is education. Government and non-governmental organizations should educate people on HIV, how it spreads, its effects, management and control. Responsible sexual life. Unmarried people, please, we are begging you. You should abstain from sex, and married people or couples should be faithful to their partners. Sharp objects. Do not share needles, razors, clippers, or any sharp objects with people to avoid being infected. In other words, go and buy your own what? Clipper when you want to cut your hair. Body fluid. Contact with infected blood fluid, such as infected blood, should be avoided. If you need blood, make sure it is tested before you do what? They insert it on your body. Another one, pregnant women. Pregnant women should be tested for HIV regularly, and when discovered to be infected, should be treated and counseled on how the child may be uninfected. Screening. Blood should be properly screened and should be HIV negative before it is transfused into patients. Now, there's this World Health problem that we are facing now. We call it what? Coronavirus, otherwise COVID-19. Coronavirus disease is an infectious disease caused by severe acute respiratory syndrome. It was first identified in December 2019 in Wuhan, Hubei, China, and has resulted in an ongoing pandemic. The first confirmed case has been traced back to November 17, 2019 in Hubei. As of 11 July 2020, more than 12.5 million cases have reported across 188 countries and territories, resulting in more than 560,000 deaths. More than 6.89 million people have recovered. Now we are going to look at the symptoms of coronavirus. One is fever. When you are having constant headache all the time, my dear, it is the symptoms of what? Coronavirus. Another one is cough. You'll be coughing all the time. Have you ever asked yourself, why this cough? It's symptoms of coronavirus. Another one is fatigue. You'll be feeling weak. And when somebody is having fever, cough, and at the same time fatigue, they are together symptoms of what? Coronavirus. Then the other one, shortness of breath. You don't have enough breath within you. And the last one is loss of smell. When you cannot perceive any smell. Even when you are cooking, you cannot perceive what you are cooking. That all of them are what? Symptoms of coronavirus. Now let us look at the prevention. One is hand washing. Make sure you wash your hand through running water. Everywhere now, we have buckets. Even in the market, church, even in our school here. Whenever you enter our gate now, you see buckets. In the staff room, you see buckets. Our principal is now making sure that all the buckets are placed all in the classes of the school. Why? For students to be doing what? Washing their hands when they enter into before they enter into their classes. Another one there is face covering, otherwise known as what? Face mask. Make sure you wear your face mask everywhere you go. In the market, in a main market, for instance, you cannot enter market without wearing your face mask. There are people around in the roads. They are taking care of people who do not do what? Wear their face mask. It is for our own good. When you wear face mask, it will help you so that any person by your side cannot do what? You cannot contact it from him. Please, we are advising you. Viewers at home, please do it. It cannot kill you. It's for us. Let us see whether we can cope up so that we can be going about. Now, another one is quarantine. When people with these symptoms, when you notice that you have these symptoms, the cough, fever, fatigue, and loss of smell, you report yourself to the government. They will quarantine you, isolate you from people, so that you will not transfer this sickness to others. Are you hearing me? Please, listen and it will be well with us. Now, the last one there is what? Social distancing. When you notice that you have all these symptoms of coronavirus, please avoid going to where people gather. Church, market, schools. That is where we are still at home now. It's not, government knows that it's very important. That is why we are staying at home. You and me is at home now because of this sickness. And we cannot come out. If you come out, all of us will get infected. Please, we are warning you. Viewers at home, my good students, I am telling you now, coronavirus is real. People say that it is not real, that they want to see before they believe. They want to become Thomas of Jesus Christ during his own time. Please don't become Thomas. Make sure you abide by these rules so that you cannot be infected. I cannot be infected. Now, the evaluation. 1. Write the full meaning of HIV. 2. List 3 signs and symptoms of HIV. 3. State 2 ways HIV can be contracted. 4. Mention 4 dangers of HIV. 5. Indicate 2 solutions to HIV/AIDS. Now, my students at home, after listening to this test, you can send your answers to the evaluation through my contact number, WhatsApp number 08064784948. Make sure you wear your face mask. Thank you.